I first met Valerie after she was referred by her local physician. Her physician had identified what he thought was an abnormal skin lesion or an abnormal mole, and had it resected or removed by a dermatologist. The pathology report at that time was consistent with melanoma, and she was referred to us. Melanoma, simply put, is skin cancer. We had to determine whether this was something that was localized or something that actually was invasive or had a higher risk of spreading. It was at that time that we had referred her to Dr. Aldrink.
Valerie's course of treatment consisted of a biopsy, which is removal of the area that had been previously biopsied. In addition, she underwent lymph node biopsies to determine if the cancer had spread to any of her lymph nodes.
Valerie did not need to undergo chemotherapy because her tumor was localized. Had there been evidence of spread to her lymph nodes or to other organs in her body, then chemotherapy would have been called for. Valerie has completed her therapy. Her surgery was successful.
Her long-term treatment will consist of surveillance or monitoring to make sure that the cancer does not come back.
Melanoma is growing in frequency in children. It is very rare to see melanoma in prepubertal children, children under the age of 11, 12, 13 years of age. We know now that melanoma is responsible for about 10 to 11% of cancers in children between the ages of 15 and 19.
Many patients and their families are very surprised at the diagnosis of melanoma in children or teenagers, and we explain to the families that this is something that's seen across the country and actually increasing. I think a lot of this increase can be attributed to skin care, lack of skin protection, and sunbathing habits. The damage is cumulative, which is why some people think that we are seeing the marked increase in the teenage population. The degree of sunburns that the child may have accumulated throughout their lifetime, by the time they get to teenage or early adulthood, is enough to result in a melanoma. Parents can start to educate their children at a very young age about the importance of sunscreen and applying this at all times that the child is out in the sun. In addition, they can limit activities such as sunbathing, tanning beds, and things of that sort that increase the risk of skin cancer to the children.
Young patients with malignancies or cancers are a very special group of patients, and they have their own particular needs. A diagnosis of cancer can be a very laborious thing for a family. There are multiple physicians involved, there are lots of x-rays, therapy is timed in particular ways, there are oftentimes second and third surgeries that have to happen. Nationwide Children's Hospital is one of the few hospitals in this country that has a surgical oncology clinic dedicated specifically to addressing the surgical oncological needs of children with cancer.
Our combined surgical oncology clinic is set up so that the patient and their family can make one trip to see the surgeon, to see the oncologist, to have their radiographic studies all in one trip rather than to have to make several appointments. And I think that it's fairly inviting to the families and comforting to them to see the teamwork approach that we have here.